Welcome to this explainer. Today, we're undertaking an objective, clinical examination of vascular physiology. Specifically, we'll be looking at how targeted dietary lipids influence the cardiovascular system and cellular regeneration in adults over 45. We're going to look past the basic advice to truly understand the exact metabolic pathways at play. To really grasp these mechanisms, we first need to define two critical components. The first is the endothelium. You can think of this as the biologically active inner lining of your blood vessels. Now, as we age past 45, the structural integrity of this endothelial lining faces some natural biological challenges, and this often leads to the second component, arterial stiffness. This is simply a gradual loss of elasticity due to cellular aging and oxidation, so providing proactive metabolic support to this tissue becomes absolutely vital. Here is our agenda for today. We'll be covering 6 main areas: vascular physiology post-45, enhancing endothelial elasticity, modulating lipid profiles, cellular regeneration pathways, phenolic vascular interventions, and preventive dietary protocols. Let's get right into it. Section 1. Enhancing endothelial elasticity and the specific role of alpha-linolenic acid. A primary compound in this regenerative process is alpha-linolenic acid, or ALA. ALA is an essential, plant-based omega-3 fatty acid. You'll find it in exceptionally high concentrations in cold-pressed walnut and flaxseed oils. Clinically speaking, ALA functions as a powerful catalyst. It mitigates inflammation markers in the bloodstream, which is a necessary first step if we want to restore the structural flexibility of those arterial walls. The quantifiable data we have on this is quite compelling. Researchers at Penn State University observed that when adults over 60 consumed just 1 tablespoon of walnut oil daily over a 6-week period, their blood vessel flexibility increased by an impressive 64%. This physiological improvement is largely attributed to the oil's high levels of ellagic acid and a specific form of vitamin E known as gamma-tocopherol. Together, they act synergistically to neutralize oxidative stress. We see a parallel mechanism in a University of Toronto study, this time looking at flaxseed oil. Participants who used 1 tablespoon of ALA-rich flaxseed oil daily over 3 months demonstrated a 15% decrease in arterial stiffness. Concurrently, they experienced an average 10-point drop in blood pressure. So this really highlights the sustained metabolic impact that consistent omega-3 intake has on vascular resistance. Furthermore, flaxseed oil contains significant concentrations of lignant. Now, lignans are phytoestrogens, and they function clinically almost like molecular keys. They elegantly trigger the body's natural endothelial production of nitric oxide. And nitric oxide is absolutely crucial here because it signals the blood vessels to relax and dilate, a process called vasodilation, which naturally facilitates improved unobstructed blood flow. Moving on to Section 2, modulating lipid profiles and their targeted biological impacts. A 2024 study in the Journal of Cardiovascular Medicine provides an excellent physiological distinction between standard saturated fats and the medium-chain triglycerides, or MCTs, that we find in coconut oil. Typically, standard long-chain fats are stored by the body, or they can impact arterial walls. However, the lauric and capric acids in coconut oil are MCTs. Biologically, upon absorption, they are routed directly to the liver, where they are immediately converted into cellular energy. And this unique hepatic routing has measurable outcomes. Data from the University of Cambridge showed that adults consuming 2 tablespoons of virgin coconut oil daily experienced an average 15% increase in high-density lipoprotein, or HDL cholesterol. This is the beneficial lipid that actively helps remove other forms of cholesterol from the bloodstream, thereby significantly improving the overall total to HDL risk ratio. If we shift our focus to avocado oil, we find another distinct lipid modulator, beta-sitosterol. A study from the UCLA Medical Center highlighted that avocado oil possesses the highest concentration of this plant sterol among cooking oils. Beta-sitosterol actually physically blocks the intestinal absorption of low-density lipoprotein, or LDL cholesterol. Additionally, the lutein compounds present in the oil were shown to drop systemic inflammatory markers by up to 40% over an 8-week period. Section 3, cellular regeneration pathways and rebuilding the vascular structure. Our objective here extends beyond simply preserving the existing tissue. It actually involves actively regenerating cellular structures within the cardiovascular network. For instance, avocado oil is composed of approximately 70% oleic acid. This specific monounsaturated fat has the unique capability to deeply penetrate arterial walls, acting as a biological trigger for the production of new, healthy cellular tissue.
When it operates synergistically with the oil's alpha and gamma vitamin E components, it provides a comprehensive defense against the oxidation of cholesterol, fundamentally supporting structural rebuilding from the inside out. Flaxseed oil also exhibits profound regenerative properties, specifically through compounds known as cyclopeptides. Findings from the National Institutes of Health indicate that these cyclopeptides safely and continuously target and break down the calcium deposits that harden existing arterial plaque. This fascinating mechanism allows for a gradual dissolution of calcified structures, completely without the adverse side effects often associated with synthetic interventions.
Concurrently, the omega-3 profile of flaxseed oil actively suppresses the production of prostaglandins and leukotrienes. In clinical biology, we recognize these two compounds as primary drivers of chronic arterial inflammation. By dampening their production, the endothelial lining is effectively shielded from the continuous inflammatory stress that typically accelerates vascular aging.
Section 4, Phenolic Vascular Interventions and the Mediterranean Baseline.
Extra virgin olive oil's efficacy is firmly rooted in its complex phenolic profile. Take oleocanthal, for example. It functions as a powerful anti-inflammatory agent, utilizing pathways comparable to ibuprofen. Then you have hydroxytyrosol, which serves as a highly potent antioxidant specifically targeting oxidized LDL. Furthermore, EVO triggers adiponectin, which is a hormone regulating glucose and fatty acid breakdown. Researchers at Temple University and the University of Glasgow have successfully linked these exact compounds to reduced brain inflammation and a clinically significant 30% drop in DNA markers.
And this brilliantly illustrates the regenerative capacity of these phenols. A 2023 study in the Journal of the American College of Cardiology documented that EVO actually increases the production of endothelial progenitor cells. Practically speaking, these are adult stem cells specifically tasked with repairing and regenerating the damaged inner lining of your arterial network.
The macroscopic clinical outcome of these microscopic pathways was definitively demonstrated in the landmark PREDIMID cardiovascular trial. This study concluded that participants consuming a baseline of 4 tablespoons of extra virgin olive oil daily experienced a 30% lower risk of major cardiovascular events. It was an outcome so definitive, in fact, that researchers opted to halt the study early.
Section 5, Preventative Dietary Protocols and their Clinical Application.
Understanding these metabolic pathways is really only half the equation. Applying them correctly based on their thermal and biochemical properties is essential. This matrix serves as a clinical guide for optimal thermal usage. Avocado oil, which is rich in beta-acetylsterol, maintains its structural integrity at high heat, up to 520 degrees Fahrenheit. Coconut oil's NCTs are stable at medium heat. EVO, however, should not exceed 375 degrees, as higher temperatures will destroy its delicate polyphenols. Crucially, walnut and flaxseed oils must remain strictly cold. Applying heat will immediately denature their fragile cyclopeptides and omega-3 structures.
We can also further enhance bioavailability through specific emulsification protocols. For flaxseed oil, the Dr. Budwig method involves combining the oil with dairy proteins, like cottage cheese. This properly emulsifies the lipids, dramatically maximizing cellular absorption. Similarly, consuming raw EVO followed by warm water and lemon creates an acidic, emulsifying environment. This enhances the gastrointestinal uptake of its fat-soluble compounds.
We must also note the application of antimicrobial protocols. The practice of oil pulling, which involves swishing coconut oil in the mouth for 10 to 15 minutes, is physiologically validated. The lauric acid in the oil actively neutralizes specific harmful bacteria in the oral cavity. By reducing this bacterial load, you systematically decrease the amount of oral and gut bacteria that can migrate into the bloodstream and eventually contribute to arterial plaque formation. So, the crucial point to take away today is that cardiovascular maintenance is a highly active biochemical process. Based on the specific cellular pathways, regeneration mechanisms, and lipid profiles we've mapped out in this explainer, how are you currently supporting the structural integrity of your own endothelial network? We hope this academic overview provides you with a clear, objective foundation for your future metabolic choices.